and gentlemen. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to this very special series on diabetes awareness. This is an initiative of the IHW Council and powered by Boehringer Ingelheim. The Think Beyond Sugar campaign has been curated to commemorate World Diabetes Day, which is a global awareness campaign on diabetes and is held annually on 14th of November. The World Diabetes Day campaign addresses various topics and issues related with diabetes, including diabetes and human rights, lifestyle, obesity, and its impact on disadvantaged and vulnerable populations, as well as diabetes in children and adolescents. If we talk about the prevalence of diabetes in India, a new study published in Lancet estimates that 101 million people in India, that is almost 11.5% of the country's population, are living with diabetes. Type 2 diabetes is the most common form of the condition. But the good news is that type 2 diabetes is a lifestyle disease and can be prevented to a certain extent. So to create awareness on this very important and critical health topic, we have, and to clear all the myths and misconceptions related with diabetes, we have organized these strategic roundtables on diabetes under the Think Beyond Sugar initiative. We are hopeful that these discussions will go a long way in educating the general public about diabetes and ways to manage it, and more importantly, to prevent it. I'm your host, Dr. Behjat, and today we will be discussing about prevalence and risk factors. And for this very pertinent discussion, I'm joined by an array of experts. We have with us Dr. Suresh Kumar, who's the Medical Director and Head of the Department, Community Medicine at Lok Nayak Hospital, Delhi. Welcome to the discussion, sir. I'm also joined by Dr. Jasjeet Singh Vasir, who's the Director, Endocrinology and Diabetology at Medanta, the Medicity, Gurgaon. Welcome to the discussion, sir. So we'll also be joined by Dr. Urvashi Prasad, who's the Director, VC Office, Niti Aayog in Samwai. Meanwhile, starting the discussion, I'll come to you, Dr. Suresh, first of all. When we talk about the increase in numbers, and Indians being predisposed to that condition, what do you think when we talk about the risk factors and how we see the whole policy regulation also moving towards the preventive aspect of non-communicable diseases? So what are the risk factors when we talk about diabetes, and in light of how that switch towards a preventive, it's like they say, prevention is better than cure. So how do you see the whole scenario evolving, and what is your take on that?
First of all, I'm thankful to you for inviting me on this very important topic.
It's our pleasure.
Diabetes is a global problem, and in India, we are having more than 100 million of diabetic population, and soon we will be number one in the world. We are discussing why the number is increasing not only in the rich population but also in the poor, in the rural area. Earlier, it was assumed that it is disease of the elite, it is disease of the rich population, but it is no longer so. It is seen all over, all ethnic groups, all set of the society, and even in the villages where a lot of people used to do exercises is also very common in the rural area. If we see the absolute number, it is a huge, and the burden is so high that every third or fourth patient who are admitted in any of the hospital is diabetes or its complication, whether it's an eye-related complication or cardiac complication or a renal failure. So most of these complications are preventable, and this is very important topic, that how we can prevent it, because we have the two type of risk factors. We are talking about the risk factor, why the risk is so high, because there are two sets of patients, one with the genetic predisposition, another set where you have the environmental factors, you have obesity, you have smoking, you have a large amount of alcohol consumption, you have poor exercise, you have poor sleep. All these leads to type 2 diabetes. So it's a type 2 diabetes, which is most common. 90% of our patients in India are of type 2 diabetes. Less than 10% are of type 1 diabetes. So we must understand that the basic difference between type 1 diabetes and type 2 diabetes is in type 1, you have the absolute deficiency of insulin. But in type 2 diabetes, you have the insulin resistance. You have the insulin, but is less secreted, or that insulin is not working because of the multiple reasons. So as a professor of medicine, we have to identify the two subsets of classifications where you have the type 2 diabetes, and type 2 diabetes is greatly increasing in the epidemic proportion. So coming to the risk factors, you can modify the risk factor, and certain risk factor you can't do anything because genetic. So if your family have some patients, your parents are diabetic, it's more risk to the kids. So you have a modifiable risk factors and non-modifiable risk factors. So this need to be very clear. So for general public, it is very important that we must do the exercise, because lack of exercise is the major risk factor for predisposition of the diabetes. And a lot of the patients don't test their blood sugars. They don't know whether they are diabetic or not. So some of these patients who are admitted for any other illness, they are suddenly discovered that they are diabetic. But there is large number of patients in the urban area as well as in the rural area where their blood sugar is never tested, and they are in the pre-diabetic subgroup, who after a certain period can develop full-blown diabetes. So this is very, very important.
And that is why we say awareness is very important, because many
Yes, yes.
times people don't get themselves tested. Coming to you, Dr. Jasjeet, since Dr. Suresh talked about the modifiable risk factors, but if we specifically talk about type 1 diabetes, and so you think genetics play an important role? What is your take on that?
So, see, Dr. Suresh very rightly put the perspective about why diabetes is increasing, and you mentioned about the prevalence and the differences of type 1 and type 2 diabetes. So, genetics, if you take it as the quantum of impact of genetics on these two types of diabetes, it is much more in type 2 diabetes than in type 1 diabetes. It's not very common to find a child who's diagnosed with type 1 diabetes having first degree relatives with diabetes. However, with type 2 diabetes, the family history is extremely important. So see, whenever we look at our patients, or we're talking about preventive strategies in a country like ours, where we house 160 crore people, we can't give preventive strategies to the whole population. So here we need to focus on the high risk individuals. Now, to stratify them, very easy to do, very easy to understand for all those who are logged in, that one, is your weight in excess or is obesity present? Number two, is your waist circumference more than 90 centimeter in males or 80 centimeters in females? Is your BMI above 23 or 25? Do you have a family history of diabetes? What is your physical activity profile, your basic eating profile? That, along with the family history, will give you a very good idea of their high risk. And sir also talked about pre-diabetes. So once you undergo blood test, you find a few numbers being high or low. We can talk about it later. But these are the high-risk people who would benefit the most with preventive strategies. We can't do it for the entire population, but the starting point is high-risk screening and interventions provided to these high-risk people. Because see, diabetes is not just treated to control the blood sugar levels. It's the impact of diabetes on the quality of life and quantity of life, which is surmounted by the complications of diabetes. That's exactly what we entail to prevent by adequately treating diabetes and the multiple risk factors that we just talked about. So very simply, the question, why is diabetes increasing so much, is answered by if we just visualize a gun which has a bullet inside. A gun with a bullet is harmless. That is the genetic or the ethnic predisposition of a population. As sir also rightly said, you can't do much about it. So these come under the non-modifiable risk factors. On top of that, nutrition, fitness, alcohol, smoking, and to me, the biggest two risk factors in today's date are the so-called word stress and environmental pollution. These are pull the trigger of the loaded gun, and that's why we're finding type 2 diabetes happening in very young population. And Dr. Suresh would agree with me, when we were undergraduates, making a diagnosis of type 2 diabetes in a 16-year-old child would mean you would fail the exam. But now in our clinical practice, we are seeing so many young diabetics being diagnosed with type 2 diabetes.
Dr. Jasjeet, you have rightly pointed out, which was my second question, that how, because you've talked about, the gender disparity, then of course, when we talk about age-related considerations, because in the last decade, we have seen younger, patients, children getting impacted. So yes, age, Dr. Suresh, you think age is an important criteria now that, we have seen it happening at younger patients and kids also. So what would you
Definitely, age, the profile of age is changing as we see that more and more young population, the school-going kids, college-going students are having diabetes because of the multiple reasons, because of the multiple risk factors. As Dr. Sabha just said, that it is stress and the poor quality of air pollution, and the new fashion of smoking. You see, the smoking is much more in the younger generation. They take it very lightly, that yes, just for fun they start and they ultimately end up in the multiple complications. So there are multiple risk factors, and more age group is involved with the newly diagnosed diabetes. So you have the certain drug abuses are the secondary causes of diabetes, not only the alcohol, but also a lot of population who take the bodybuilding or steroids, they have the more chances of getting diabetes. We have seen many patients in our OPD that the patients are taking some supplement or some bodybuilding steroids, and these steroids and drugs are also the very important cause of diabetes in young. Then you have the more and more people are now having the fashion of driving the cars. They are not going out of the car. They are just lack of exercise. Lack of exercise is the major problem. That if you do the regular physical activity exercise, then you can prevent diabetes. But if you always drive a car and hardly walk, then the late most of these student or young generation, they go for sleep late, midnight sleep, or they have changed pattern of sleep. So the late rising, पहले हम कहते थे कि आपको सूर्य उदय से पहले आपको उठना चाहिए, तो आजकल के जो बच्चे हैं वो तो 7-8 बजे से पहले उठते नहीं है. सो यू हैव द मोर चांस ऑफ गेटिंग इनटू द इंसुलिन रेजिस्टेंस. So the changing lifestyle and the food habits in the school children, in the college children, they are more into the Pepsis, colas, and the pizzas. The fast food have very high calorie content, high glycemic index. So this is another food habits, is another predisposing factors for the early development of the diabetes. So that is also a very, very important aspect.
Right.
For
Right,
this epidemic.
Dr. Suresh. Very rightly, we have covered, if we talk about the risk factors, that how, this change in lifestyle and the move towards urbanization, then of course, packaged foods, and how we are leading a very sedentary lifestyle, traveling by cars, and that, and with a mobile, and even the free time that we have is spent, before a screen only. So we have, I think, covered pretty much on the risk factors. Coming to, challenges, as Dr. Jasjeet, I would first come to you, and then I would go to Dr. Suresh for that answer. When we talk about, challenges that healthcare professionals face, considering both prevalence and risk factors, which we've already covered. So what are some of the challenges when we talk about, diabetes management as such in the larger part of the population?
So, Dr. Bejit, I would actually expand your question to enter into the domain of prevention of diabetes, because that is extremely important. Uh, Considering the size of our population, it's virtually impossible to give the perfect diabetes care to these large number of people. That is a realistic challenge. And with each person who develops diabetes comes the future risk of developing other non-communicable diseases, of which cardiovascular and renal complications like heart attack, heart failure, kidney failure just keep on surmounting the pressure on the overburdened healthcare system. So I'm not really an expert on that, but if I were to ensure the best level of care for diabetes in our country, I would move towards prevention of diabetes. You know, a very simple and an interesting fact is somebody who's overweight or obese, just losing 3 to 5% of their current body weight can prevent diabetes. However, once somebody develops diabetes or is diagnosed with type 2 diabetes, you need to lose at least 15% of your weight to remit diabetes. Now, what is easier? Start at as early as possible. And that's why in today's date, upstream approach of managing non-communicable diseases is more prevalent. We look at a person, we calculate their overall risk for these non-communicable diseases. And in all of these risk factors, obesity seems to be the most impactful intervention or weight loss, which can help to prevent 229 plus health complications, including diabetes, hypertension, PCOD, etc., etc. Because once diabetes happens, it's kind of mostly lifelong, and it requires monitoring, testing, regular visits, screening of the complications, and the drugs. So this is an entire package of the expenditure or the journey a person would have to go through for a disease which is very likely, which can be prevented. So I would really invest in prevention of type 2 diabetes, and that would really take care of the burden of diabetes on our healthcare system.
Right, Dr. Jaspreet. Very, beautifully you have captured the whole essence. Dr. Suresh, coming to you, when we talk about the preventive aspect, and like we have discussed about how that level of awareness needs to be, created but diabetes, when we talk, especially we Indians, we always, relate sweets with diabetes, and like Dr. Jaspreet rightly pointed out, that stress is another very important factor. So what are some of the misconceptions, because we are trying to create that level of awareness for our audience, and to wo jo ek ke bas meetha khane se, meetha mat khao, diabetes ho jayega. Like my father used to complain that your mother gives me so much stress and she doesn't let me eat sweets. So what is the role of stress when we talk about diabetes, and stress as an important risk factor?
Definitely, stress is one of the important cause leading to diabetes. Longer the stress you have, the longer the insulin resistance. If you see, your stress not only causes diabetes, but multiple metabolic syndromes. The poor sleep or stress causes high blood pressure, coronary artery disease, irritability, the various psychological issues, and various hormonal issues. When we must have a balance between the good hormones and the bad hormones. So it is very important to know that what are the hormones which have a imbalance. The imbalance is caused by stress, because you have certain hormones which keep you happy. So if you are happy, if you are stress free, your body is balanced, you don't have the weight gain, or you have no abnormal weight loss. So there are a very important aspect that ultimately all the hormones are controlled by brain. So if your brain is not calm, if your brain is have excessive stress, this lead to the cascade of various hormonal abnormalities you have the imbalance between the good hormones and the bad hormones, and you have the insulin resistance. This leads to a lot of predisposition for the diabetes. And stress is not only the simple the one way of like somebody is not having the job leads the stress. Stress is because of the multiple personality problems, thinking process, their financial process. So there are the multiple reasons of stress. Even you try to pretend that you are happy, but because of pollution, because of the AQI, very severe category, you can't help it. You can't control the external environment. So you have the bad air sometimes lead to stress. So there are the certain factors which your body can't control. Then you have the spiritual health, your thinking, and the negativity. So there are multiple aspects that are all combined, and this leads to the insulin resistance because it is ultimately the cellular metabolism, the glucagon and the insulin balance. So this, when you have an imbalance between the beta cell functions and other parameters, and your sleep cycle changes, your eating pattern changes, and this ultimately leads to the type 2 diabetes. This is the main cause.
Yes, Dr. Justin.
So I very patiently waited for Dr. Suresh to complete because I was really bubbling when Sir was sharing the aspects of stress and he mentioned a lot of neurohormonal changes which drive the outcomes of stress. See, the interesting thing about stress is शुगर चेक करनी है ग्लूकोमीटर है ब्लड प्रेशर चेक करना है ब्लड प्रेशर है we have all these diagnostic tests which can objectively measure these health parameters. Waist circumference करनी है वेट करना है weighing machine पे खड़े हो जाओ. However, there is no objective assessment of stress. Number one, it's what you're feeling, and it's sir really said it very right. It's something which works at a level of the mind, not even the brain. It's something above that, and it's medically proven. I'll give you an example that obesity is driven majorly by these neurohormonal connections which need to be rewired actually if you need to lose weight. So it is true, and stress is like a web. It has multiple associations. आप blood pressure की बात करें, sugar की बात करें. So many patients come back and tell us that we had this certain event in the home and the sugars shot up. I can only measure the sugar levels, but the level of stress and the impact on an individual's health should cannot really be measured. We can only experience that. Also, everybody who's joined in, I would like to make it very simple for them as a causation and a solution to diabetes. Let's take look at these 5 fingers, which each one of these fingers contributing to the end result, let's say, which is 100%, which is diabetes. सबसे पहले आ गया 20% nutrition. Second 20% आ गया fitness और exercise. Third 20% आ गया drugs, etc., etc. Fourth 20% comes stress, and fifth 20% comes sleep. Now, with these 5 things, we have a clear association, and Dr. Suresh also said it very well, equal to a disease happening, right? So 20, 20, 20, and 20. So when we know the reasons, we need to take care of these 5 things to ensure a long, healthy life. We talk about wellness. We don't talk just about controlling the blood sugar levels. Wellness is your entire experience of health in a day multiplied by the number of years that we live this life. So in a solution form, आपको थोड़ा सा nutrition, थोड़ी सी exercise, medicines, work on your sleep, work on your stress, and that's where you make a strong fist and you beat diabetes. That's how I look at, and that's how I would counsel my patients. And they feel very happy that yes, we have the power to control it. We have the power to prevent it.
Jeet, very rightly have pointed out, which was supposed to be my next question, that because you also and Dr. Suresh also talked about the importance of counseling. So you think as a healthcare professional, when patients come to you for remittance or for diabetes management, what role you think counseling at that stage plays?
So diabetes actually falls in the category of chronic care. Chronic care, it's not a cough cold where I don't actually have to communicate with a patient. I just tell them you have XYZ infection and this is the antibiotic, and you're going to recover. Chronic care is like a journey. So we have to be with our patients all through that journey. So the relation goes much beyond just a doctor patient consultation. It becomes, it may come to mentoring, supporting them in any possible way. So that's how any and every patient who comes to me, that's what is there in my mind, is this is the support I am providing you. I don't need to say that in words. And counseling, actually, after the first few visits, it's more about counseling, which leads to the most successful results. I'll just give you a very small example that most of the diabetes, let's say 50% or more of people who have increased blood sugar levels, don't have any symptoms. Now, if I were to explain to a patient the importance of checking their sugars at regular intervals, you know what I would tell them? That here I'm giving you a guarantee card. We all love guarantee cards, means safety.
Right.
I'm giving you this guarantee card. You keep on checking your sugar levels. So what is going to come out of that? When you find your sugar levels uncontrolled, what will you do? You will definitely think what happened, what happened in the diet, and all those factors we talked about. You will self-correct it. It's an automatic way of empowering patient to control it. You check it again. If it comes normal, you will give yourself a pat on the back. Yes, I did well. And that's how we are empowering our patients to take care of their diabetes. The other thing, then you check it again and you find it high. What will you do? You will come back to your healthcare provider. You'll come back to me. So any path you take, sugar testing, just giving you an example, goes a mile in ensuring their long, healthy, happy lives. So that's basically an example of what counseling would do in diabetes care.
Right, Dr. Jasjeet. And I think we are joined by Dr. Urvashi Prasad.
Yeah, hi, I'm here, yes.
Welcome to the show. So we have Dr. Urvashi Prasad with us. She's Director, VC Office, DDI. Welcome to the show, ma'am. So
thank you.
So we were discussing about, we've already covered the risk factors and how counseling plays an important role, how that holistic shift towards a preventive lifestyle is important when we talk about diabetes and the growing numbers that we can see in the country. So coming to you, Urvashi, we would like to get an overview of how this shift towards a preventive lifestyle, especially government regulations, policy, everything is moving towards, like Dr. Suresh and Dr. Jasjeet were also discussing about how prevention is better than cure. So the whole narrative is shifting towards the preventive aspect of all diseases for that matter. So would you like to give us an overview on how the whole shift is happening at the policy level?
Yeah, so in terms of preventive, there's a few things that have been happening. One is that there's been a lot of focus on creating awareness about healthy lifestyles. So, whether that's diet, whether that's exercise, sleep, all those kind of, issues, especially amongst young people, adolescents, youth, but really all age groups. But of course, we have to start young because I think, in our population, whether it's diabetes, whether it's other chronic diseases, they're all setting in at much earlier ages, and people are getting affected at much earlier ages. So we have to start young in terms of, trying to bring about these lifestyle changes. So one is the whole behavior change, communication and creating awareness through different platforms, whether it's through schools, or whether it's through health and wellness centers, which are being set up under Ayushman Bharat. So I think that is one whole stream of, work that is happening. The other, of course, is trying to see, how we can integrate our traditional knowledge, into the sort of modern lifestyles. So whether it's traditional knowledge in terms of food, we've had like millets. We've tried to bring back millets, right? Millets is not a new concept or a new, crop. But we try to bring it back into the modern lifestyle, modern diets. Similarly, yoga. Yoga is something which is very, ancient traditional knowledge in India. But we're trying to bring it back and saying that, integrate it into your modern lifestyle, however you can. So I think that is one whole sort of stream of work. But the other is, of course, enabling people to make these better behavioral choices, because it's not enough to create behavior change. You have to help people make those choices as well. So, whether it's in nutrition, ensuring that there is access to more nutritious food, and it is locally available, it is affordable, or but even simple things like exercise, making sure that when you do your design of cities, then you do your city planning, urban planning. You make sure there are spaces, where people can actually go, people can exercise, tackling pollution. This is a big issue, because these are all things that affect a person's environment, and their ability to, actually make the right choices. So I think we are trying to work on both those tracks. That, of course, we try to encourage individuals to, adopt healthier behaviors, but we also try to provide them with that enabling environment. And I think that is where a lot of the hard work, still needs to go into our policies and programs, especially at the state level.
You've pretty much, there was a separate question on how we integrate our traditional systems, but you've pretty much covered that about how yoga and, of course, introduction of millets, which Dr. Suresh and Dr. Jasjeet were just now talking about, how that shift towards an urban lifestyle is one of the major risk factors, that has gradually increased those numbers. Coming to you, Dr. Suresh, when we talk about that shift towards a preventive lifestyle, you think, awareness, that level of awareness needs to be created? And what are some of the, partnerships, collaborations that you can think of? Because as Dr. Urvashi also pointed out that, everything can be there, but until and unless people are aware of how to, use them for better health outcomes. So what is your take on those, awareness and better collaborations for that awareness?
This is very important aspect, because once diabetes, it is for lifelong most of the time, until unless it is reversed. So if you have the diabetes, whether it's type 2 or type 1 diabetes, the most important part is diabetes education, diabetes complication prevention, and the lifestyle modification. So here comes the important role of the physicians. Have hardly time to educate the patients, because they just prescribe the medicine. You take insulin, you take metformin, you take this. But they have no time, more particularly in the government setup, because government setup have the large number of the patients, and the physician-patient ratio is, the national average. We have the shortage of doctors. So we need to have a complete comprehensive unit where you have the diabetes educator, you have the dietitians, you have the various team where you have the, most of these patients have a very poor healing. They have the diabetic foot ulcers, they have the retinal problems, they have the kidney problems, they have the cardiac problems. So it's a big team, comprehensive approach. And the diabetes prevention, complication prevention, and the diet plays, I think, more important role. Half of the management is by drugs and insulin, and 50% role, rather I should say more than 50% role is the dietary modification, correct carbohydrate intake, and the counseling of the patient. Because just to say that you don't take sweet or ice cream or this XYZ is not go down well with the patient, because they have the social obligations, they have the functions, and the food crawling is there, and there's a lot of problems. So you have to have a clear cut diet chart, what you can take, what you should avoid, what you can take in a moderate amount, what are the certain food which you should compulsory avoid. So these are the long-term impact where the diabetes management really the outcome changes. And I think the dietary chart is one of the most important part that you should teach the patient at all the level, all the times.
Right. Dr. Jasdeep, coming to you, since you also talked about how nutrition plays an important role, Dr. Suresh also talked about how diet plays an important. There are a lot of, things, जैसे आप सुनेंगे daily practice में करेले का juice पी लो, and things like that. So when we talk, if we are creating general awareness among masses, especially children, they go for packaged foods and all. So in simple terms, if we tell them ये खाना है, ये नहीं खाना है, so what would be your advice?
Wow. And I really thank Dr. Suresh for giving me all the leads for my answers. So see, the thing is, first of all, one very important thing in diabetes is it gives us multiple chances of prevention. Before a lady gets pregnant, it gives a chance of preventing diabetes. Once the child is born, it gives a chance of preventing diabetes. Once multiple risk factors happen to an individual, it gives you another chance for preventing diabetes. Once diabetes happens, it gives you a chance for preventing complication. So the word prevention is sacrosanct whenever we talk about diabetes or metabolic diseases. That's very clear. Coming to your question about nutrition. So there are two words, nutrition and diet. Let's understand this very clearly. जैसे कोई भी आदमी डाइट बोलता है ना, सबसे पहली चीज you rightly said कि ये नहीं खाना, ये नहीं खाना, वो खाना, right? That's the normal perception. So in my clinical practice, I have stopped using the word आपका diet chart बनाना है. I tell them, and that's science. I tell them that we are going to plan your nutrition. Now, nutrition is what your body needs. It includes carbohydrates, fats, proteins, micronutrients, macronutrients, everything in the quantity they require. Now, if you tell me make a diet chart or a nutrition plan for right now, so I will just make it in 5 seconds using 3 words: quantity, quality, and timing. These 3 words encompass everything that is required for successful nutrition. These are very gross ways of looking at it. Another very impactful way of when we talk about nutrition is whenever we have our food, just spend a few seconds looking at your plate. And I guarantee you, हम सबको पता है वो plate में क्या है. We might not know कि carbohydrate or percentage or simple carbohydrates or complex carbohydrates. I don't want you to know. But what I want you to know is do mindful eating. Look at your plate for a few seconds. लेकिन अगर सामने टीवी चल रहा होएगा ना, तो मैं टीवी को देखूंगा, मैं अपनी प्लेट को नहीं देखूंगा. These are simple tips which on platforms like this are even more important in creating that awareness कि मैं क्या कर सकता हूँ without having to go to a doctor. And Dr. Urvashi talked very rightly about the fact it's about changing the behavior. And behavior does not change in a teaching class. It happens in life, and the social media in today's date is so strong. While sitting here and the COVID epidemic proved it, thousands and millions of lives were saved by the social media. So let's use the power of that. Let's have more programs like this. Let's have more faculty like all of us present here and many more to percolate something which is very easily understood. See, as a student, I always loved listening to the teachers who would make my lesson very easy. And I would ensure कि मैं उनकी class जरूर attend करूँगा. So that's exactly where, coming back to the nutrition part, just follow these principles and you're through with it.
Right, right. Very rightly. Dr. Urvashi, you with us? Yeah.
Yes, I'm here. Sorry, I'm just outside, so I'm just going in and out.
Yeah.
But yeah.
So one more question, because you've pretty much answered most of my questions that were there from a policy perspective. But like Dr. Jasjeet talked about the power of social media when we talk about that level of awareness creation. So you see, and COVID has, no doubt acted as a catalyst when it comes to using those means. So in the coming, in the coming times, do you see that how, these public awareness campaigns, you talked about behavior change. So what role can this, social media, new and innovative, even when we talk about health per se, telemedicines and things like that, how can technology be a enabling force when we talk about that level of awareness creation?
Yeah, I mean, technology, no doubt, is playing and is going to play an even more important role. But I think it's important to realize that technology is not the end in itself. It's a means to an end. It's an enabler. It's a facilitator. But it's not, something that. Because sometimes it's easy to get carried away with technology and think that that is going to solve all the problems. But certainly, it's a big enabler in terms of helping us achieve scale and all of that. And in the pandemic, definitely we saw an accelerated adoption of technology, of telemedicine across the country. It wasn't just in the large urban centers, but it was across the country. But I would say that we need to keep up that momentum because sometimes I feel that we can be in danger of losing that momentum, that we actually built with technology during the COVID period. So we should keep up the momentum. We should keep learning, from the lessons that we learned at that time. And it should not be a one-off. It should not be that, okay, we used this during the pandemic, but now the pandemic is over, so we kind of go back to business as usual. So that should not happen. So I think that is important. And also, of course, we have to ensure that technology, its reach is equitable. It's reaching everybody, all populations across the country, rural, tribal, remote, all kinds of areas, because again, it can't be just an urban phenomenon. And I think in terms of social media, I mean, I would say that, of course, the reach is tremendous. The kind of potential it has is tremendous. But I would also put out a word of caution to people when it comes to social media. And I've been saying this on a lot of the platforms that I've been speaking on, that, everybody is an influencer, whether it, and I think it's fine if it is just fun, lighthearted things. But, if it's health and nutrition and, issues that relate to your life, and your well-being, then I think you have to be very careful, about the messages you consume. And I would also kind of reach out to the influencers, people who have large numbers of followers, that, you also have a responsibility, and you also have a certain consciousness towards society that you must have, that, you use that reach in a responsible manner. Because, sometimes even the kind of things I find, the content I find, I get a little worried because people who are not necessarily experts in nutrition or in healthcare or in fitness or whatever are, just putting out certain content. And so I think I just put out a word of caution there, that we need to use social media responsibly, but otherwise it can definitely have tremendous reach and especially with the youths.
Right, Dr. Urvashi. Very rightly you've pointed out with so many channels and platforms, there is a lot of scope for miscommunication as well, and that is why I think sessions like this can prove to be very important in making sure that the facts reach the audience. And when it comes to health, of course, it is a very, very critical issue. So coming to you, Dr. Suresh, like Dr. Jasjeet talked about how social media, technology in the when we talk about diabetes as a disorder per se, so there are we say technology has changed, that we have now, you have wristwatch which can actually tell you that this is your BP as of now, these are the steps that you have taken. And so you think this personalized technology and interventions can in the coming year change when we talk about the growing number of diabetes, because we talked about obesity, sedentary lifestyle. Somewhere down the line, when we talk about these customized personalized equipments, can they prove to be important game changers in that regard?
Definitely, they are for the next few years. The technology is very important, and you see, it's very important to know the daily fluctuation in the blood sugar levels. So you have the glucometer, for example. You know that your fasting blood sugar is 200 or 300. Similarly, you have certain equipments which tell your continuous blood sugar monitoring, so that if you know your sugar levels are high, you can take the corrective measures for your next meal, for your dinner, and you can change your dietary habits. So this is very, very important, because once you know that these technology, new gadgets, new tools are there which helps you, but most of these new technology gadgets, they are beyond the reach of poor patients. Or most of urban elite can afford this, but the rural area where the people are very poor, they don't have money to buy the medicine. They don't have money to take the good quality food. So for that population, it is very difficult. So we have to see that how this technology, the tools, and the newer methods of can really help. But definitely they prevent the complication. They are better. Now the AI is changing the game. The artificial intelligence is used, and there are other techniques, but they are still in the pipeline. And definitely it is of a very, very useful in the future.
Right, Dr. Suresh. You've rightly pointed out about the concerns of accessibility and affordability. And like Dr. Urvashi also pointed out, how equity has to be there when we talk about newer technologies or these personalized gadgets for that matter. Dr. Jasjeet, coming to you, what is your take on these changes?
So, see, we talking about two areas. One is personalized medicine and then community medicine. Both of them cannot work on the same principles. Community medicine is kind of the pivot for prevention of diseases. When we come to individualized therapy or personalized therapy, then sky is the limit. As Dr. Suresh was also talking about, a simple thing. If I have to check somebody's sugar levels, I can either tell them to go to a lab, I can tell them to buy a glucometer, a simple glucometer, a glucometer which is attached to their phone by the Bluetooth, a glucometer which can give a graph of what is going on, or tell them to come on a continuous glucose monitoring every 15 minutes. That gives you a graph of what is going on through the day. That is just the very basic of technology, talking about one thing, sugar monitoring. We have these devices, etc., etc. They are very empowering. However, it should be used very wisely, because if I give you a device which will check your sugars these many hundred number of times, just see what is going to happen once you see those numbers every day throughout the day. And what does it create? Back to the drawing board, we are increasing the level of stress, what we right away started off from. So it is my responsibility to decide which technology should be offered in which situation, assessing the fact what would be the pros or the cons of that technology in a particular individual. On the population based thing, things are very, very different. We need to approach it from a more realistic point of view than saying everybody needs to have a smart watch for that. That's how I look at technology and diabetes and prevention and all these things.
Right, Dr. Jaspreet. Very rightly, you pointed out how, it can, sometimes further your risk of developing that kind of stress that is there. So yes, a word of caution should be there when and Dr. Urvashi was also referring to another aspect of the same thing, because there are people who are, on different platforms where they are giving health information, health tips, and then the other day you see somebody else talking about just the opposite. So yes, it is important that you have a sense of caution, a sense of responsibility, because when it comes to health, it is a very, very critical issue.
So can I just add to what you just said? Let's take an example of diabetes reversal. You type in diabetes reversal, you will find 10,000 articles, 20,000 people, association, this, that, who are promoting reversal. Let's talk about the science behind it in 30 seconds. Number one, diabetes is reversal is the wrong word. Remission is the right scientific word. Any and every medical association all through the world uses the word remission. So reversal is like you're going straight, you take a U-turn, you're going in an opposite direction. To a patient, what does that mean? What does a patient want to hear? Sugar control, dawai band, and you are allowed to do whatever you want. So very honestly, that's what a person desires, that you eat everything and do everything. But what does remission mean? Means you continue on a diet, exercise, a lifestyle change. Your sugars become normal. You come off medications. However, when you stop those lifestyle changes, diabetes is likely to come back. So there are the differences, and that's how we need to be very wise in this area of using the correct words. And then we had a lot of discussion about social media content and all these things. We have to filter them. Just think about an individual who's in despair because he or she has developed diabetes. They will look for the place where they say your diabetes is going to get over. What would be the natural response of that person is to adopt that, not understanding it may be harmful. So it is our responsibility, it is my responsibility. And in tune to that, I made a series of 4 videos which I shared with all patients and all platforms, talking about the science of remission of diabetes.
Right. Very rightly you pointed out how, this misinformation can further impact the health. Coming to, we have pretty much covered the risk factors, and, how different technologies can help in bridging that gap when it comes to, better management. So Dr. Suresh, coming to you, when we talk about, diabetes and its impact on other, because we briefly touched upon how cardiovascular health is affected, renal failures are there, then of course there is this impact on your kidneys. So in a nutshell, if you would want to, if we are talking about giving awareness or information or knowledge to normal people, what are some of the impact of diabetes on your overall physical and mental well-being, though we have mostly covered the mental aspect of it?
You see, diabetes is a chronic disease. It causes microvascular complication, macrovascular complication. Almost every organ is affected by diabetes. But basically, for a general public, they should know what are the basic problems associated with the diabetes. Number one, the eye problems, very common. They can have cataract, they can have vision problem, they can have retinal hemorrhage, they can have various eye-related problems. So eye checkup is must. Annual eye checkup is very important. Then they can have the cardiac problems. They can have dyslipidemia, they can have hypertension, they can have cardiomyopathy, they can have cardiac failure, they can have coronary artery disease. For that, they have to go for certain testing if they have the chest pain or breathlessness or dyspnea and exertion. Then third is the kidney. Kidney problems are very common. They must get the urine examination for microalbuminuria and the overt problems. They have overt nephropathy. So the urine examination, blood urea test, serum creatinine test, the ultrasound of kidney is very important for certain. Then urinary tract infections, UTIs. Urine infection is very, very common in the young age as well as in the elderly population. So urine examination, urine culture, they are very important. Then the peripheral neuropathy, foot care is very important. So these complications, if anybody have the burning sensation in the feet, lower limb, then the foot care, there are a lot of need to be discussed about the foot care in diabetes. किस तरह के उनको जूते चप्पल पहनने चाहिए, किस तरह को उनको वॉक करना चाहिए, वो सारी प्रॉब्लम्स बहुत जरूरी हैं डिस्कस करने के लिए. Then they have the psychological problems and other multi-system involvement. They can have other diseases, chronic problems. So all these, the drugs related, then the pancreas problems are very frequent in these patients. So it is very important that it is not a single doctor which can handle the diabetes. It is a teamwork. It is a multidisciplinary approach where you have the nutrition fellow, dietitians, physicians, you have the endocrinology people, and you have the all other specialties involved in the diabetic management. So it is very, very important to know about the basics of the long-term complications.
Right. Dr. Jasjeet, you would want to add something more?
Definitely. Like in the past 1 hour, Dr. Suresh has been feeding me with all the information, which I translate into, there is a patient in front of me, मुझे इसको कैसे समझाना है. So let me try to do that. Is that explaining to somebody, it's very important for any successful effort. We need to know if we do something, what gain we get, and if we don't do something, what is the possibility of a loss. So that's exactly what Dr. Suresh said. We're talking about two things, quantity of life and quality of life, how long you live and how happily and healthily you live. These are the two aspects. Now, putting all the complications in that perspective, the vital organs like vision, what will happen to your quality of life when vision becomes a problem? Doing the small little things, that becomes one aspect of quality. What happens if you can't walk up the stairs because you get short of the breath? What happens if you can't walk because of involvement of the blood vessels or the nerves of the feet? Just to mention a few, and then it keeps on going down into organ transplantation like kidney and liver. That's the not so good news. But the good news is it's all preventable. We just do the 5 basic things of nutrition, fitness, drugs, and we've got drugs which can help not just control sugars, they have a weight loss benefit, they help control blood pressure and heart, liver, kidney, and brain protection. And sleep and stress, we are back to the 5 pillars of managing diabetes. Regular visits to your doctor, regular screening of complications is how I would summarize my discussion about diabetes awareness.
Right, Dr. Jasjeet. Very, very nicely you have put on those 5 points, which was my next question, which was supposed to be my next question, that what would be your media, but you've already summarized it beautifully. Dr. Suresh, coming to you, since we are running short on time, how would you, just summarize the whole discussion and your major, takeaway for our audience today, if you have to give it in a...
So most important is that if you have the symptoms, don't neglect the symptoms. You must have the blood sugar measurements, whether you are in the village or you are in the cities. The screening is very important. If you have the problem, go to the doctor, get blood sugar tested, get diabetes tested, get your eye checkup, get your all, if you are having the family history, that is very important. That early pickup is very, very essential for prevention of the long-term complication. Early you are diagnosed, early you take care of your blood sugar, it is better managed and better. The end organ failure is not there if you are timely diagnosed, because as Dr. Jasjit has said, that it is not the reversal of diabetes, but is definitely you can have a remission and you can control the complication, and you can save your vital organs from the complication of diabetes. So awareness is very important. That is the key message.
Right, right. So that basically brings us to the end of the show, and I'm thankful to Dr. Jasjit, Dr. Suresh, and of course Dr. Urvashi Prasad for being here with us, and taking out time from your busy schedules and taking part in this discussion. And I'm sure that our audience today will take a lot of relevant information, and it will inspire people to move towards a preventive lifestyle. And yes, Dr. Jasjit.
I'm sorry, I have to say this. I really would love to congratulate Dr. Bajit, you for organizing this, your entire institution for doing this great efforts towards awareness about various diseases. And I promise, and I'm promising it on media, that I promise my unconditional support to any future endeavors you want me to be a part of. And I thank all of you.
Yes, sir, that is.
Thank you, ma'am. Thank you. But just one correction, that I am not professor of community medicine. I am professor of medicine, internal medicine.
Okay.
I am basically physician and medical director of person.
Thank you, Dr. Suresh, Dr. Jasjit. And it is, this participation from experts like you that really, keeps us going.
Right. No, it's very good initiative. I must give a big hand to you and your team. Yeah. Thank you.
Thank you for us. And this was the very first episode of Diabetes Awareness Series, Think Beyond Sugar, which is an initiative of IHW Council and powered by Boehringer Ingelheim. So we'll again see all of you in yet another interesting episode. And meanwhile, keep following our social media pages for more updated information on health and well-being. Thank you once again to everyone.